Hi everybody, this is Michelle Weber and I'm talking to you today about hospital length of stay. The length of stay refers to how long a patient stays in the hospital from the time they're admitted to the time they're discharged home. It's usually calculated in days, but it can also be calculated in hours if it's a shorter length of stay. It's a measure that's used for hospital utilization. It's typically looked at in terms of the average length of stay of a patient. So in the early 80s, healthcare costs were rising, particularly Medicare costs, and so they passed the Prospective Payment Solution along with the Social Security Act in the early 80s. And what this did was take healthcare from a fee-for-service model to a prospective payment model. And it did this by assigning patients according to procedure or diagnosis while they were at the hospital and getting paid based on that, instead of for every service that was performed while they were in the hospital. And what these DRGs do is sort of assume that all patients that get this procedure or this diagnosis are similar and should be costing the hospital about the same, therefore the reimbursement should be about the same. Over time, DRGs have evolved so that it's not just a Medicare and government payer used type of reimbursement. Private payers are using it too, and they've grown to include things like complexity of a patient, the age, it's elderly, pediatrics, and basically it gives some room for how sick a patient is, and that you would get a higher reimbursement based on the type of patient that you're caring for. So with the move to this DRG-based payment model, there were definitely some concerns from people that it could potentially cause more quality and safety outcomes for the patients, negative quality outcomes, because people would try to be pushing them out of the hospital faster, knowing that they're only expected to get paid back for this much time of a patient staying. But after time, it was actually found that that was not the case, and that the length of stay was significantly impacted in going down, and quality issues did not rise. So this, and then into the early 90s, there was a downsizing of hospital beds because there were hospital closures, there were mergers into big health systems, there was migration to outpatient care with medical advancements and more things being able to happen quickly and outside of the hospital. So I have a couple of graphs that I'd like to show, showing the length of stay and how it's decreased over time from the 80s up until about 2009 in these graphs that I'm about to show you. So in the graph that you see here, you can see that the average length of stay in community hospitals has been steadily decreasing. In 1993, we were at about 7 days as an average length of stay, down to about 5.4 days in 2013. So the length of stay is commonly used as a measure for financial productivity, staff productivity, quality metric, and it's typically correlated directly to the cost of care of a patient. So it's the resources that are used, the staffing that attend to the patient when they're on whichever unit they're on in the hospital. There's a direct cost associated with those things. Those are supposed to be sort of counted into your DRG and your case rate payment. So knowing what your expected length of stay is for your diagnosis is really important, because if you do better than the benchmark of how many length of days of stay the patient's supposed to be there, then you can potentially keep the extra money. If you have the patient stay longer than the DRG suggests that they should, then you can lose quite a lot of money. So we look at excess days as a measure of that in terms of how many days a patient was longer or shorter than what is determined as their according to their DRG, what the length of stay should be for that patient. So we monitor that very closely in financial offices of different hospitals. We also talk about opportunity days. So opportunity days are the cases that you discharge the patient over the determined length of stay. So an example is if a patient supposed to be there for 5 days, but they stayed for 9. Those 4 days are considered opportunity days, days that you could have done better. We also talk about excess day reduction, which is how we budget. So we budget a percentage reduction of the opportunity days from the year before. We want to get better than we were the year before. So I have an example here of just a couple of simple metrics that I'd like to show that we use very often in the hospital that I work at in terms of measuring how productive or how good we are at meeting the length of stay requirements. So what you're looking at here are just a couple of metrics. The first being the average length of stay, which we've discussed. The second being the average NACRI length of stay, NACRI being the National Association of Children's Hospitals. And then third is our excess days. So I'll break this down for you. You can see headaches and seizures. Those are two different diagnosis codes. 102, 103, those are DRG codes, so those are what headaches could fall into. The average length of stay, our average length of stay in 2015 was 2.5 days. In 2016 it was 2.6 days, and then year to date we're at 1.8 days, which is actually very good. We're doing a good job of getting these patients out faster. Well, we hope it's good. I mean, this is just one part of the story, like we've talked about many times in class, but the length of stay is going down. The average NACRI length of stay, now this is a benchmark that we use at the Children's Hospital to see, basically to set ourselves at a goal. So the goal is 2.5 days, and we are well surpassing that, which as you can see in this excess days category here, we are doing very well. You would like to see your excess days be a negative number because it means you're discharging faster than the benchmark, which is usually a good thing financially. So in both of our DRGs, as you can see here for headaches and seizures, our excess days are doing very, very well. And they've, for the most part, done better year over year. So that's just an example of what we look at. And thank you very much for your time. I hope you learned a little something about hospital length of stay, and have a good day.